Good afternoon, everyone. My name is Brooke Smith. I decided to do my pathology project on Situs Inversus. I chose to do this one because I saw a different type of Situs Inversus during my CT rotation. I will explain that later on in my presentation with other slides. So I want to start off with what is Situs Inversus. So Situs Inversus is a type of rare genetic condition where the organs in your chest and abdomen are reversed and mirrored from a normal person's anatomy. The medical term for where your organs are normal or in a normal person's body is called situs solidus. And so nearly all of your organs in your chest and abdomen will develop in a left-right formation. But a person with situs inversus, their organs will develop in a right-left formation. I also have a picture on the right side to show what it looks like in a normal person's anatomy and with their organs versus what it would look like for a person that has situs inversus. So how does situs inversus occur? So it usually is caused by a rare genetic mutation. The mutation is linked to 100 different types of genes, and according to an article I got off of nature.com, roughly 1 in 6,000 to 8,000 people have situs inversus. I believe that number has changed to every 1 in 10,000 in today's society with the advancement of research ongoing. And in order to pass the gene down to their offspring from the parent's genes, situs inversus has to be in a recessive type of pattern. So where does it occur at? So because it is a rare genetic mutation and everything, it can basically affect any organ inside the body, and it can occur anywhere in the body. So I have a following example listed right here, but to shorten it up, if you have the liver and gallbladder is typically on the right side of a normal person's body, but a person with situs inversus, it'll be on the liver and gallbladder will be on the left side of it for the abdominal region, and then for the thoracic region you typically will have the left atrium and the left lung will be on the right side of the body with a person that has situs inversus. So as I mentioned earlier that I saw a different type of situs inversus during my CT rotation. There are different types. There's only 2 known to this day because of the advancement of the ongoing of research and everything. Those 2 types are known as dextrocardia and levocardia. So dextrocardia and levocardia are basically the same thing, except it just depends on the way of where the apex of the heart is placed at. So dextrocardia, the apex of the heart will be located on the right side of the body. Levocardia, the apex of the heart will be pointed towards the left side. I do know some people can have dextrocardia or levocardia and may not have situs inversus. They may just have that type of condition. But typically a person that has either or one of these will have situs inversus. Okay, so these are some images from an MRI. The top MRI image is in a coronal view. It was done in a T1 relaxation phase. You can see that the liver and gallbladder is on the left side of this patient, and the spleen and descending colon are on the right side of the patient. And you can also see down here on the bottom image, this is done in axial view, and I believe this was done in a T2 relaxation phase. But you can see that the right lung, which is right here, this one is the right lung, is actually on the left side of the patient, and the left lung is actually on the right side of the patient. And then this right here, this structure, sorry I'm not a good drawer, is the descending aorta, right in this one. And the descending aorta is positioned on the right side of the body instead of the left because this person has situs inversus. The importance of the role of imaging and its impact on situs inversus. So this is very, very important when it comes to us radiographers or any imaging tech out there. We have to make sure that the patient has situs inversus and that it's not mistaken for a flipped or misprocessed image, because if we send a flipped image to the radiologist and they look at it, they're probably going to think, oh, this person may have situs inversus or may not. So if we send the wrong thing will get dictated in a report, and it can just be a whole bunch of confusion between the techs, radiologist, the patient, and everyone involved. So I do know that there's different challenges from the different imaging modalities with situs inversus. If you want to see more finer details of the structure and everything with situs inversus, you would want to look at MRI. But if you want to see kind of like an outline of it, you would want to do CT. And also, if a person that has to go under surgery with situs inversus due to anything that happened, surgeons must adapt to how the anatomy is displayed to make sure that they're not cutting on the wrong side of the patient and whatnot. And these type of things require high quality of care and complex understanding. When surgeons or any of us, to make sure that we have a great foundation and understanding of how important it is when we are imaging situs inversus. Signs, symptoms, and risk factors. Okay, so you won't typically have any signs or symptoms because you can only get this through a rare genetic mutation or by birth. But people that suffer from situs inversus can also have underlying health conditions. And some of the risk factors of those include biological family history of cardiac defects, diabetes in the birthing parent, use of tobacco products during pregnancy. There's a list right here, but these are some of the ones. Also, most people that has dextrocardia with situs inversus, they tend to have a lot of cardiac defects or issues sometimes. Treatment options. There are no treatment options to help with situs inversus. Again, if you have an underlying health condition on top of it, your healthcare provider can give you medications or other treatment options to help with those issues. But you can't go to a surgeon or request to have a surgery to get your organs reversed to fix the condition. It is what it is. These are additional images of a chest x-ray, and this is also another MRI image. And right here, I'm going to show you guys. Right here, it's right here, and right here. This is actually a heterogeneous mass that's inside of the dome of the liver inside of this patient on top of the situs inversus. I have additional images of CT of how the apex of the heart is backwards. This right here is your descending aorta, and then this is actually the left lung, and then this one is the right lung of this patient. Those are my references. And that is my presentation. Thank you everyone for taking the time to listen to my presentation.